Alrighty, we'll go ahead and get started. Once again, I'm Max.
Cheyenne.
I'm Natalie.
Alrighty, anyone want to read this case study?
I can read it.
Okay.
Okay, so we're doing the putting it all together case study for a middle school student with ADHD, type 1 diabetes, and social determinants of health. Social history, we are in a school setting in a rural community. We are taking care of seventh grade student. He's 13-year-old named Aiden. He is an only child in a single parent household. Aiden's grandmother was living with Aiden and his mom until she passed away in July. Aiden's mom is a local retail grocery assistant manager and works evenings and weekends. Aiden receives free and reduced meals and eats both breakfast and lunch at school daily. His breakfast is at 7 a.m. and his lunch is at noon. Aiden is an overall strong student and a very social and has a specific learning disability called dyscalculia, which is difficulty learning and working with numbers. Medical history and current health status. He is an otherwise healthy child who's fully vaccinated and diagnosed with both ADHD and type 1 diabetes in early elementary school. Aiden is able to provide a lot of self-care with his diabetes management, and you are to delegate daily care to his unlicensed assistive personnel. Aiden has an insulin pump and a continuous glucose monitor. His pump has a basal insulin level set at home, and he receives mealtime boluses at school. Aiden's mealtime insulin cover ratio is 1 unit per 12 grams of carbs. His blood sugar correction dose is 0.5 units of insulin for every 50 milligrams per DL over 150 milligrams per DL. Aiden also takes his methylphenidate 30 milligrams by mouth at breakfast and 20 milligrams by mouth at lunch. History of present situation. You have only worked with Aiden 1 year previously, and his glycemic control had been fairly stable. Last September, when you checked in with mom with the start of the year care planning, his A1C was 7.0. You recall that at the end of the school year, it was a little less stable when his grandmother was placed on hospice, and Aiden missed a lot of school and had to be reminded to report for medications before meals several times. You have noticed since school started this year, his blood glucose has been elevated each morning, despite having continuous GCM monitor with alarms. Present situation, it is Monday morning and you receive a call from your delegated caregiver that was supervising Aiden's breakfast insulin bolus, and Aiden's CGM is reading over 400 with a trend of increasing. He denies abdominal pain or nausea. You advise that his bolus is administered as you are just walking into the health room. You've been interacting with Aiden. You have double his blood glucose. With a finger stick, his reading is almost 500. You have him check his ketones as per his school diabetic orders, which are a trace. He continues to deny any symptoms other than a slight headache. You double check Aiden's insulin pump, and his pump and tubing is intact and patent, and his basal insulin is running. Upon further assessment, you find that Aiden has been estimating his carbs for his dinner bolus every night based on about whatever my lunchtime carbs were, stating that he never really got the hang of counting carbs because my grandma always did it for me, and they were always calculated at school. Aiden further states that his mom is working most evenings and sometimes he forgets about his dinner just completely. He states he is unsure if he took any insulin last night. When you ask about his alarms on his CGM, he states that he silences them often because they're very annoying. After speaking with Aiden for a bit, his blood glucose is trending downward and he is drinking clear liquids and continues to be asymptomatic. You have him go eat breakfast and tell him you would like him to come back to the office after breakfast so you can talk further. He agrees. When you call his mom, she states that things have been very stressful since her mom passed away and bereavement leave was only a few days, and states they do not have any additional family here. She also notes that Aiden and his grandma were really close, but he doesn't share his feelings. She states that Aiden is forgetful and that he doesn't like math, but should be able to calculate his own carbohydrates. She further said the doctor should just talk to him about this. When you call his endocrinologist, she shares that Aiden's hemoglobin was checked last month and was 12. She's concerned about the family and discusses further support. And that is our case study.
Thank you very much for reading that out loud.
Yeah, that was.
Question 1. What further assessment questions might we want to ask Aiden when he returns? So it seems like we're trying to balance his diagnosis of type 1 diabetes, ADHD, he has dyscalculia, and then he also has a caregiver. What was it? An unlicensed assistive personnel.
Yeah, and he just lost his grandma.
Yeah.
He just lost his grandma, and he's having difficulty managing his insulin therapy because of his increased A1C and poor carbohydrate counting. So I think our questions will obviously all be based around that. So
per Lippincott and Pfizer, I found some questions like based off of like type 1 diabetes, assessing, like what do you know about counting your carbs? What do your meals typically look like? And when or how much insulin are you giving yourself? When are you giving yourself insulin?
Those are great ways to assess like where they're at right now, like with their disease process and their understanding and everything.
Exactly. Um,
Or like, could you walk me through your process of
yes.
carb counting? Like, how do you count carbs? Yeah.
Yeah.
Like, how do you take your, like, how do you remember to check like your blood glucose and take your insulin? Like, do you set alarms? Like, what's
Mhm.
your routine, I guess, to say?
I think it does say that he has alarms that go off.
Yeah, he does, but he silences them.
He silences them, yeah.
Mm,
And it seems like reading off of that, like it seems like the school is very well aware of his um, condition because it says that they count his carbs for him.
Hmm.
yeah. And I know that
So
he gets, it says insulin boluses at school. So they're
yes,
doing his medication when he's there.
yeah. Maybe assessing like whether he's journaling or if his mom is also helping him with his journaling and logging his like blood sugar readings because I don't know I'm not like very aware of like the machines and if there's like an app that you can download like I don't know if that's how it
Yeah, they
works
have
or
apps
not.
now that like kind of
Okay.
tracks like your sugar. Yeah, it's really cool.
Okay.
Yeah. But yeah, usually they had like back in the day, they had like
Yes.
the logs and you would like put the date and time and everything
Okay.
like that. So so whatever is like more effective for Aiden, like whatever's better for him. If he has a phone, great, you know, and like he does have like that the glucose, the glucometer kind of in him, and then he has the pump too. So I mean it's
Yeah.
pretty easy just to scan your phone on there and see like what your blood sugar
Oh,
is. And
yes.
then your pump I think automatically is supposed to regulate your body without you having to regulate it, to my understanding, and then you just change it every 3 days.
Yeah,
Okay.
it says that he just basically isn't managing his insulin
Yeah.
boluses. And so I think a question I would want to ask for him is that since he's silencing his alarm because it's annoying, my
Yeah.
question would be, why don't you administer your insulin when your alarm goes off?
Right.
No?
Like, what is your thought process there? Why?
Yeah.
Maybe like why do you find it annoying? Um, I think pertaining to his ADHD, like even with his medication, like is he? I don't remember if it states like if he's taking his medication still continuously or not. But like even with that medication, do you still find it hard to like focus or stay focused, sit still, or complete any assignments?
Maybe we need to just like ask him like the basics, like how he feels about everything.
Right.
Like he's
Yeah.
13 years old, like he has all this peer influence, you know, people like who knows what kids like laugh about or joke about or talk
Yeah.
about, you know. So it's like he has that and it's like he's at that age where, you know, they're starting to like talk to girls or whatnot and starting to have like those relationships. So it's like, is that being
Yeah.
affected too? Like that could also affect his like mental status, especially like not wanting to control it.
No, that's a really good
Especially with
point.
losing his grandma recently, that stress
Right.
might
Yeah.
also impact how he's interacting with other people, but then also
Yeah.
with his diagnoses and with how he's presenting at school, they might be bullying him for stuff like that. So
Absolutely.
making sure that we're investing in that's very important.
Yeah, he
Yeah.
could be going through some like depression too. Like maybe like he was already going through depression with his diagnoses and then his grandma died, who was his like
Right.
main support, which seems like his like favorite person, you know? So like
Mhm.
now he's like, well, what's the point of managing this? Like,
Yeah.
so
Yeah. That's why I think another question I would ask is like, since your grandmother's passing, like, do you feel supported by other people surrounding you, such as like your friends or
I'm
how?
gonna put sorry, Cheyenne. I'm just
Are you
gonna put,
good?
have you ever had thoughts of like harming yourself
Oh yeah, that's a really good one
or
too.
others? Yeah, cool. Awesome.
Okay, I think we're ready to
Great.
move on.
What patient problems are immediately identifiable in this situation? I would say the hyperglycemia with
Mm-hmm.
500 milligrams per deciliter, along with his most recent A1C of
Yeah.
12%.
Yeah.
Yeah. 7 to 12 is
12,
a
12,
big
12%.
jump.
Sorry, his most recent was 12.
Yeah.
Yeah.
Mhm.
Yeah, that's a really big difference right there. That's
Mhm.
concerning.
I think another problem is like his um like not knowing how to count carbs and adjusting his insulin doses or so ever.
Absolutely.
Yeah.
Maybe he doesn't have the education on it,
For sure. I
like
think it
proper
like states
education.
that yeah, his grandma did all of that for him.
Mm-hmm.
And it seems like as we stated already, like it seems that like the school does the carb counting for him when he's there. So even then he's having other people not that he's having them do it, but like other people are in charge of doing that for him. And so maybe that's why he doesn't know how to do it.
Yeah.
Yeah, because think about it. And now his mom is working nights and weekends. So he's
Yeah.
home alone,
Mm-hmm.
figuring out what to eat, figuring out how much insulin to give himself. Like he's like looking at this thing, put the microwave. He's like, yeah, it's probably like 300
Yeah.
carbs, but it's not correct, and maybe he doesn't know how to work the pump properly. Like there's so many things, or like
Yeah.
what his insulin dose actually is. Like, is he even giving himself the correct dose? You know what I mean?
Yeah.
So all of those things.
Reading the Davis Advantage textbook for carbohydrate counting, it's talking about how you need to teach the patient about foods that contain carbohydrates, how to appropriately feed food labels or read food labels, and
Yeah.
what serving sizes are. And so that kind of begs the question of being 13 years old and with where he's at, does he know what a carbohydrate is, yay or nay?
Yeah.
And, like,
Yes,
how can
I
we
think that's
build upon
important.
that?
Mhm.
Even like teaching them like the free carbs. Like my brother's a diabetic and he's like, oh, I can eat this because it's free. I don't have to. I'm like, oh, that's cool. Like back
Yeah.
in the day, they had to like use the needle on the stomach. Like he didn't have the pump, you know. So every time you wanted to eat something, it was like you got to give yourself a shot. So
Yeah. Exactly.
they call them free carbs. I don't know if that's like the proper medical term, but
I mean, yeah, it is. His ADHD, and if that plays like a factor with his glucose monitoring and his type 1 diabetes. I feel like that's a problem in his current situation.
Yeah.
And then let's see, emotional distress, like due to like his grandmother's passing,
Hmm.
and considering that they were super close. And then his mom states that he doesn't like to share his feelings, so I feel like that could also be a emotional or psychological problem.
yeah, he's a young man. So like it's kind of frowned upon. Like society is like, oh, you're a boy, like you're a man, like like don't cry, you know,
Right.
like be strong. But it's like no, it's okay to like your feelings are valid. Like it's okay to feel these things and like express them and let them out. Like
Yeah,
yeah, survivor guilt, even, you know, like
for sure.
anticipatory grief because wasn't she on like hospice or something? So it's just
Yeah.
like that's very traumatic to go through to watch someone you love like deteriorate. So that really could affect it too.
Oh yeah, for sure.
Yeah.
Okay, I feel pretty good about this one.
How are we going to primary or prioritize addressing these problems and why? We can start with like his physiological issue right now, which is his hyperglycemia and uncontrolled like diabetes management. So maybe just like working at correcting his hyperglycemia because type 1 diabetics are already at an increased risk of DKA, which is basically anything above 250 milligrams.
Mhm.
But then on top of that, while he doesn't have any symptoms now, it's better to treat him while he is asymptomatic, besides his headache, rather than in the future when he might actually start presenting with DKA symptoms.
Mhm. And then another problem to address is like his medication adherence and proper doses, considering he like doesn't know how to count his carbs, his meal plans, or whatever he's eating, can really affect the medication that he's taking and how much he should be taken or given.
Yeah, like insulin doses and his methylphenidate.
Yes, 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 yes.
And real quick, I just want to point out that for the hyperglycemia and DKA risk stuff, that was from both the Davis Advantage textbook and a source called Type 1 Diabetes in Children by Lowe and Wilt. So that's just my source there.
Perfect.
Great, thank you.
Mhm. Mm. All right, so correcting hypoglycemia is number one.
Um,
And then two, did you say medication adherence?
yeah. Mhm. Sorry, I could have wrote that.
Absolutely, yeah. Because how do we know his like insulin dose is even correct if he's not like taking it? Like, because he hasn't been consistent. So if he was consistent and like his blood sugar still wasn't managed, then maybe we could be like, okay, like we need to change the dose or like talk to the provider. But
Right. But, and then he also states that like he doesn't even remember if he took it
Yeah,
the night before. So that almost makes me like think if that medication is causing that symptom or not. Oh my gosh.
I'm also
No idea.
thinking like for number three to prioritize like Aiden's like mental health
Mm-hmm.
because I feel like that goes like unrecognized so much. But I think it's super important in this case. Like if we want him to be successful with his disease, we have to make sure he's like mentally ready for the education, you know.
Yeah.
yeah. This is coming out of the Harding MedSurg textbook regarding ADHD. It's talking about how difficult psychosocial care can be in any
Yeah.
patient diagnosed with ADHD, including a 13-year-old adolescent, and how some families may need like further education on the medications, signs and symptoms to look out for, and how to properly like take care of like daily living and activities of daily life. And so just talking that kind of goes in with his mental health management to making sure that everyone is up to date with what's going on, what to look out for, any complications to be aware of.
Mhm. Okay. Are you guys ready to move on to the next? I can just read off the question while you're still finishing up that.
For sure. Go ahead.
The next one is how might these problems impact long-term health outcomes?
Mm.
I feel like as stated, like as we mentioned above, like improper like glucose readings can lead to like diabetic ketoacidosis. Although he's like showing like no signs or he's asymptomatic, it's definitely a complication that can lead to like long-term health outcomes such as like hypoglycemia or hypokalemia and cerebral edema. And I got that information from Mayo Clinic. And these conditions can also cause like cognitive problems such as like memory issues, difficulties with learning and concentration. And I feel like that's also really big considering he also has a diagnosis of ADHD. I feel like improper medication adherence or improper doses of medication can lead to um, vascular complications such as impaired memory and concentration, um, diabetic retinopathy, nephropathy, atherosclerosis, and coronary heart disease. And I found my information from Harihar et al. And it is a article called Profiling of Macrovascular and Microvascular Complications in Young Onset Diabetes.
Also see like psychological stress, if not managed, it can lead to poor glycemic control in the
Mhm.
results of like the A1C levels. So just like leaving it untreated can lead to long-term complications, maybe like social isolation, poor self-esteem, academic difficulties, or sleep disorders.
Yeah,
And I found that on Mayo.
perfect. Okay. Feel pretty good about that one. Do you guys think there's um other health outcomes?
No. Yeah, no,
Okay.
his poor like A1C and glucose levels paired in with his medication and psychosocial factors, I feel like are the most relevant parts of this case.
Mm-hmm.
So
Yeah, and I added into like his mental health and coping skills, just like for the future, like once he becomes like an adult, like how is this going to affect him?
Right.
Not managed properly.
Mm-hmm. Okay, moving on to the next question. What does Aiden's dose of methylphenidate suggest about his ADHD?
So, according to the nursing drug handbook here, for methylphenidate,
Mhm.
there's numerous capsules that he can be eligible for. So we don't know if it's like the instant release, sustained release,
Right.
or extended release. But for the
Mhm.
most part, children 13 and up are started around 10 to 20 milligrams per day. So with him, it's two different doses, separated morning and evening, or
Yeah.
afternoon, I think.
Yeah.
Um, so for him, he's getting 50 milligrams total, which is nearing the maximum dose of 60.
Oh, wow. Yeah.
So since he's getting the near maximum dose, I'm guessing it's like moderate to severe ADHD.
Yeah.
So just keeping that in mind, I guess, as we move forward, that's a
Yeah,
pretty.
I agree too. If he's having to take the highest dose and he's taking it twice a day, like, and you said it's usually done once a day?
It depends on if the capsule, because he's taking pills and capsules. So if it's an immediate release, that's normal to have it twice a day. If
Mhm.
it's an extended release, you typically just want one. So my guess is he's on an immediate release.
Mhm.
So that kind of goes back with the medication adherence because methylphenidate has a lot of like interactions and things going on. So making sure that he's actually taking it at the right time of day
Mhm.
can also be a big part of medication adherence and safety. Right. Ready to move on?
Yes.
Yep.
What potential social determinants of health or environmental factors are identifiable in this study? Um, okay, so going on to healthy people 2030,
Mhm.
he might be eligible for like economic stability related to his like rural Title I schooling. He's utilizing the free and reduced meals,
Mhm.
which that doesn't necessarily mean he has financial difficulties, but it can insinuate it, so just further investigating into that can be important.
Mhm.
Um, Also, healthcare access and quality. Once again, since he is in a rural location, these places tend to have less healthcare resources, increased poverty, and decreased health insurance.
Mhm.
Not only is that on Healthy People 2030, but it's also on the CDC as well for, let's see, it's called just about rural health.
Yeah. And then another social determinant of health is social support. Sorry, did you already say that? You
No,
did.
I said
Okay.
economic stability and
Yes.
healthcare access.
Okay. I blinked out for a second. Yeah. Social support, as like, as mentioned, like in the case study, his grandmother, who he was like very close to, has passed away and could possibly like affect his mental health, and as he doesn't like to talk about it. Um, and also his physical health that could also affect it because he's unable to count his own carbs, and his grandmother did that mostly for him. So providing that support as well would be helpful for him.
Yeah. I think those are really big factors, along with his mother, who's often away working.
Yes, 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 yes. That's a good one. Mhm.
Yeah. So he's just isolated because he's mostly alone if he's not at school, and if he's getting bullied at school, then he has no one
Yeah.
to talk to.
It also makes me like question kind of like, I mean, what is the legal age at in like each state that a child can be unsupervised at home too? Because like
Mm,
if she because she's a single parent, he's a single child, like who is he home with in those times that his mom is, out and
I
working?
feel like he's at the age, depending on what state they're in. I don't know if it said it, but
Yeah.
it just depends on the law. But he's 13 years old. More than likely, he's able to be at home for at least a few hours by
Few hours.
himself. Yeah.
I
At
would
least
think
maybe
too
like
that
6 or 7 hours, but I don't think anything greater than that. Like I wouldn't leave him alone for 24 hours.
Right.
Maybe that would be like 16, 17, 18. But yeah.
Mm-hmm.
But yeah, state specific, I guess.
Yeah.
it does say that sometimes he has some of his daily care delegated to the unlicensed
Oh, that's right.
personnel, so we don't know how often she's around. And plus,
Mhm.
yeah, as Natalie mentioned, it might vary state to state.
Yes.
So just keeping that all in mind.
All right. Moving on. Given Aiden's environment diagnosis and biological age, what are some possible contributors to his deviation from his care? Okay, going back to possible contributors to his deviation of care, I think his diagnosis of dyscalculia affecting his ability to count, as that condition causes like problems with numbers. Um, I think that's a
Absolutely.
yeah, a contributor.
How is he going to count his carbs if he like can't get his numbers correct? Like that's
Yeah.
it's going to throw everything off. Math has
Mhm.
got to be exact.
Yeah.
Yeah, I would say that his dyscalculia and ADHD,
Oh yeah.
Yeah, because the
it seems
difficulty concentrating.
yeah, difficulty concentrating, and the fact that one of the biggest issues and contributors to his poorly managed insulin is the fact that every time he hears the alarm going off, he's just ignoring it, which is a symptom of ADHD. It's that just you're like not paying attention to your what's going around you, and even when you do notice something, you're easily distracted.
Mm-hmm. And then his emotional distress related to the loss of his grandma.
Mhm.
Yeah, absolutely. Yeah, that can take a toll, especially like it seems like they're very close family, so she probably raised him. Probably been in his life since before he was born.
Exactly.
Yeah. Let's see. There was one more thing I had.
Yeah.
Low parental supervision related to single parent household.
Mm-hmm.
He just doesn't have like direction. Like he doesn't have anyone to like guide him to be like, don't do this, don't do that, or like explain like why the reasoning. He's just
Yeah.
alone.
Mm-hmm.
Mhm.
And
He's like just thrown out to sea and like figure out how to swim.
yeah, basically. I mean, he has like his caregiver, but like we don't know how often she comes. And besides that, it's not her. I feel like it's not. Back to what you were saying, like it's not that caregiver's like role to be like, oh, you can't do this, we can't do that.
Mhm. And on the Davis Advantage Maternal Child Nursing Care, talking about ADHD and typical symptoms is talking about difficulty organizing tasks and activities. So not only does it go with his own personal care of managing his insulin therapy and ADHD dosing with his methylphenidate, but also orienting himself with his mom, working with his unlicensed um, assistant. So just
Mm-hmm.
trying to day after day work towards taking care of himself, he's going to have difficulty keeping track of things and managing things.
Yeah.
Absolutely. Absolutely.
Yeah.
Do you guys feel good about that one?
Yes.
Yes.
Go on to number 8. What are some evidence-based tools that can be used to support Aiden in improving self-efficacy?
Mm-hmm.
I'm thinking like help with like on the phone, like if he has a cell phone, like I know kids are super tech savvy, so depending on what kind of thing glucose reader he has in his arm, yeah, he could like get the app and kind of download it. That might be more fun than like trying to give him a book to do. It
Oh,
might seem more like a chore, like it might seem kind of fun to him to be able to track it.
yes.
And you
I
can
know
kind of
there's,
turn it into a game, like, hey, like
yeah.
give him positive things. If you keep your glucose within this, let's go out to a ball game or something. Let's go do this. So like
Yeah.
the mom could create like some incentive. Like I think that might help too.
Mm-hmm.
Also,
But I
from
don't know if that's evidence based. That's probably family centered interventions.
Yeah.
Jumping ahead.
fine.
Sorry, guys.
No, you're
No,
fine.
it's good.
From the an NHS website called Living with Type 1 Diabetes,
Mm-hmm.
for evidence-based practices, it talks about how there's some classes that are available for type 1 diabetes, and they're meant to help assist with um, blood glucose monitoring, which in this case he doesn't need assistance with, but also it helps with carbohydrate counting.
Mm.
So a class like the
Nice.
DAFNE can help. Let me search what that stands for because I don't know what it means.
That's interesting.
Yeah.
That class exists, which I'll figure out what it means in a second, but there's also apps that have been shown to help diabetics manage it in the past. Oh yeah, the class is basically dose adjustment for normal eating. So I'll
Interesting.
copy and paste that. Oh, you're getting it.
For
Okay.
normal eating.
Yeah, they're it says type 1 diabetic course. So I don't know if it's online, mixed like with online and in person, or just in person, but either way, with ADHD, it seems like one of the best ways for him to learn is physically interacting with something. So whether or
Yeah.
not that's an app or physically interacting with like a course where he's learning how to take care of himself, those are both two really good ways for
Yeah.
managing his carbohydrate counting in type 1 diabetes.
Right.
Absolutely.
So I'll throw in the citation for that if you want to move on to number 9.
Yeah. So I'll keep talking about the family centered interventions and yeah. So like the mother being involved in the care, like providing incentives, like encouraging like her child self-care, like
Mm-hmm.
maybe if possible, like involving like him in maybe some counseling
Oh, yeah.
for his mental health.
Mm-hmm.
He's been through so much, you know, even just having a disease like type 1 diabetes, like that can really mess with your mental health. So I think even just from that, even if he didn't lose his grandmother, like that would be important for them to get him counseling help too. Just to kind of help him adjust. Like I don't think kids understand like it's okay, it's normal. Like I said, like the bullying comes into play and like the name calling and he might not even want to deal with insulin at school because of what people are saying. So that might be a reason that his blood sugar is so high and so uncontrolled because he just like wants to pretend it doesn't exist.
Right.
Mhm.
No, that makes complete sense. That should be accounted for sure.
Mhm.
I think you covered a lot of the family-centered interventions. Do you guys think there's can you guys think of any other family-centered interventions?
Not a direct like intervention, but maybe something to keep in mind. I'm reading the pediatric
Mm-hmm.
ATI book, and
Yeah.
it's talking about how like 13-year-olds have like much stronger autonomy at this
Mm-hmm.
age, but they also might see themselves as like more resistant to change and like able to take care of themselves even if it's shown that they can't, which we
Yeah.
kind of see in this case where he's trying to manage his insulin and it's obviously
Mm-hmm.
not working because his A1C has increased 5% up to
Mm-hmm.
12 now. And so he's trying to work through the stuff that he physically is not capable of at the moment. And so just trying to better prepare him and his mom as much as we
Mm-hmm.
can. And then
Yeah.
also managing delegating tasks to the assistive personnel.
Yeah. I'm even thinking like the mother, like if the mother's not like if her cup's not full, like she's not going to be able to support her son. So like maybe like even looking into some services like support
Mm-hmm.
groups or maybe like some more hours for home aides. Like I don't know if her caregiver is like through the government, but I know like sometimes you can get a certain amount of hours
Yeah.
depending on like what you need. So that could be something. And then just like maybe resources, since she is a single mom, like resources like food stamps,
Mm-hmm.
Medicaid, things like that that might be able to help her out.
Yeah. So reading the Davis Advantage textbook, when it's talking about care managers, or sorry, case managers, that's what it's all about, like getting families in touch with those sources. So maybe for family center interventions is like consulting. Yeah, I might even add this at the beginning. Consulting a case manager.
Really good.
Absolutely, yeah. Case managers are so great. Like, there's so many resources I think people aren't aware about. So I think
Mm-hmm.
just like bringing the education, like, hey, you like fit all of this criteria. Like, if we can like help get some food in your fridge, like how like could that help you? Like, would that
Yeah.
take the stress off you? Because sometimes that's all people need is just like a little bit of help, you
Yeah.
know, to change their whole outlook on their situation. Because we don't know like how she's been doing. She's a single mom, you know, and then her mom, that's her mom that died. So it's like, how is she doing? I know we're focusing on the child, but if she's the main caregiver for him, then we need to think about her as well.
Yeah, I totally agree.
Yeah.
I don't think our focus just has to be on Aiden when his mom is just as part of the picture as he is.
Oh,
Right.
yeah, for
Yeah.
sure.
I'd say that's pretty good for question 9. You guys want to move on?
Yeah.
Right.
I think we got everything and more.
What are some potential patient-centered education topics to address with Aiden?
Let's see. Carb counting
Yeah, so carbohydrate counting.
Mm-hmm.
and his alarms. Like, obviously, the alarms aren't working. Maybe we need to do something different.
Yeah,
Maybe like a phone call would work, or maybe like a text message or interactive game if we could figure out something like that. I don't know. We just know we need to do something different. Those alarms are not working.
Yeah. Right. Sorry, she keeps coming up to talk to me.
That was really
Um,
cute.
medication adherence for his type 1 diabetes and his ADHD is a important education to address.
yeah. And this is all stuff that we've already seen in the Davis Advantage textbook.
Mm-hmm. I think it's also very important, like along with the carb counting, maybe talking to him about I get that he is also like kind of like still pretty young, but maybe just introducing like meal planning, um, and journaling possibly just to keep track. Okay, like hey, like I've ate this before, and this is within a certain carb count that I can have, so maybe I can have this again. Like I don't have to recount it or something like that
Oh,
if I'm
what
using
source did you get that off of?
Lip and Caught.
Okay.
Yeah, sorry.
Nice.
Okay. Let's see.
Did we talk about grief support yet?
Yeah, that's a really good one.
Yeah, because I think just talking about grief and like especially like I was talking about earlier, like he's a male, so like society just views it differently. I think just like really letting him know that there is a safe space, like his feelings, it's okay to express it. I think
Yeah.
that could go miles because he might just think that he has to hold everything in.
That is coming straight out of ATI. It says, quote, adolescents can view themselves as invincible to bad outcomes of risky behaviors. And
Yeah.
so he's kind of trying to take care of himself, and yet he's at the age where he doesn't he thinks he's fine, even though we can see over his like long-term health monitoring with his A1C especially that he's not taking care of himself, and that what's
Right.
going on right now
Yeah.
is
For sure.
that's I agree support's a big part of that.
Yeah.
All right. You guys want to move on?
Yep.
Yep.
Alrighty. Who are important individuals to coordinate with on caring planning for Aiden? I think the biggest one right now would be the unlicensed assistive personnel,
Yeah,
because
I agree.
he would be able to provide like that constant education, constant updates on like, or sorry, the notifications maybe even like, oh, this is when you should be doing your insulin boluses. She could help send the text out. They can just be
Mhm.
scheduled on her end. And any kind of topics that we feel like should be more addressed outpatient, she could definitely help with.
Mhm.
And then we already mentioned the case manager is super important for helping facilitate any financial needs they might have, any resources in the area.
Mhm. I think endocrinologists to also help coordinate care with his type 1 diabetes.
Absolutely. Especially like the education they can provide, like
Oh, yeah.
is amazing.
Mhm.
Like there's so much to learn about type 1.
Yes.
Yeah. It says he already has an endocrinologist, right?
It does, but I mean,
Okay,
I think it's just like it's noting like who is important
perfect.
in this
Perfect.
care. So
Yeah,
I think
absolutely. Yeah.
everyone plays a role. I think a nutritionist or a dietitian to help him. Also, also,
The school nurse, maybe?
yeah,
Like she's going to be an important part of his care. Like if he's
yes,
going to school every single day,
yeah,
she needs to be involved too, like what's going on, like how to help him.
yeah.
Mhm. For the dietitian, what would the dietitian be helping with?
Could be doing meal plans.
Healthy meals, yeah, like
Okay.
what to eat, like if you're hungry and you don't want to give yourself insulin or you're like
Mhm.
exact like things like that. So I think it can help just like healthy meal
Yeah.
planning, carb counting even.
Yes.
Perfect.
I think other people who are important include like how Nat said, like his teachers, but like also like the principal, making sure that everyone there is like well aware of like his condition.
I think you just have to advocate for your client too. Like I think just the more people you tell, like even if you were to tell like his teachers, um, that could even influence because they could be like paying attention for signs and symptoms in class, you know. So I think advocating for your child's the best. So like maybe educating the mom on that.
Okay. I feel pretty good about that one.
Yeah. Just for a source for all these people, the Harding MedSurg textbook is talking about meeting like certain goals and making sure that nutritional therapy, drug therapy, exercise, and continuous blood sugar monitoring are all managed with the interdisciplinary team. And so all these people will help with that.
Perfect. Okay.
Right. Moving on to question 12. What immediate interventions can you implement to assist Aiden with glycemic control?
I think helping him like I'm sure maybe he knows how or understands like how to check his like CGM, but also like assessing his blood glucose levels, like if he's there at the hospital or like if his unlicensed assistive personnel can help him as well. And then providing access to sources of like glucose or like if he is like hypoglycemic, maybe like little snacks here and there that can help him get his blood sugar levels back up.
Yeah, like teaching him the rule of 15s, right? Is that what's
Yes.
called? Hypoglycemia. I remember
Yeah.
seeing that in the
Yeah.
Advantage textbook.
Hmm.
I think it's important too, like to be like, hey, show me how you give yourself a dose. Like I want you to like draw it up. Like I know it says
Yeah.
he has a pump, but like
Hmm.
how are you programming it into your pump? Like show
Exactly.
me, because that could be like a mix up too, especially with his numbers.
Hmm. Um, Alrighty. I think those are like the main things we need to work on right now because he's
Yeah.
asymptomatic for DKA.
Hmm.
It did say it was decreasing now that we've like interacted with him. So I
Yes.
feel like a lot of his immediate concerns are honestly working with his long-term health,
Yeah.
which is kind of what we're doing, making sure he's educated, making sure he knows how to like maintain his blood sugar properly.
Hmm.
So I think that these are all really important. It
Okay.
looked like this was in the
Moving on
Yeah.
to number 13. What is at least one other intervention you can provide to Aiden for health promotion and maintenance?
See.
mm,
I'm thinking like teaching like stress strategies, like maybe like meditation or like deep breathing exercises. Like, I mean, I know I've seen men do like ballet,
Oh
yoga, so
yeah.
it's like nothing's like off, like whatever helps.
Hmm.
And then also like providing resources. So maybe like Aiden could be in a support group, like maybe there's other children around his age that have like similar diagnoses or like grief groups, like similar experiences as like a young adult. He's 13 years old, you know, he's a young teenager.
mhm.
Maybe just like connecting with his peers. I know like at this time, like teenage years, it's super important to connect them with peers because peer influence is really big.
Yes.
So if you can connect him to like a positive group with a good outlook, like that can also help him be positive as well.
Yeah.
Yeah.
It's a really good one.
Also some long-term like education we can do. I'm reading ATI is talking about like with type 1 diabetics and type 2 diabetics, they're at an increased risk of like diabetic ulcers and neuropathy on their feet. And so teaching like monitoring his feet every morning, um, do not wear sandals, walk barefoot, or wear shoes without socks. Um,
Absolutely. Like proper foot care, like don't put lotion in between your toes, like
mhm.
make sure your feet are dry.
Yes.
Yeah, it's talking just all about making sure that there's no injuries on the feet. And then
Yeah,
also making sure that he's able to recognize the signs and symptoms of
Yes.
glycemia and hypo.
absolutely.
Because right
Absolutely.
now he's hyperglycemia and he doesn't really seem to be aware of it because he's asymptomatic. All he has is a slight headache, and
Yes.
besides that, he has nothing else. So making sure
Hmm.
that he knows like the severity of what's going on, why it's very important to manage this.
Yeah,
Hmm.
because you cannot have symptoms but be actively high or
Yeah.
low blood sugar.
Mhm.
Yeah.
Mhm.
Alrighty.
Okay.
Yeah, that was great. I was like, that was good.
Number 14. What are 2 ways you can measure outcomes for Aiden?
I would just say like his A1C because I know that's super
Yeah.
important. Every 3 months, just kind of monitor, just to see how the meds are effective.
Yeah, going to this type 1 diabetes in children article by Lowe and Wilt is talking about how let's see, I just had it. Basically, his optimal A1C should be below 7.5. Yeah, the American Diabetes Association recommends an H1C of less than 7.5. And so just trying to make sure he's there and it stays
Yeah.
there is a very important outcome for him because that's what's going to be most reflective of his long-term health.
Hmm.
Um, and I'll throw in a citation for that.
Perfect.
We could also like measure like his mental health status, like just following up on like how he's feeling, like if like his mental status has improved, like his coping mechanisms, like how he feels now about his medication administration, like if anything's changed.
Hmm.
Yeah. Like after almost as if after all the education that we've given him at this point, is he comfortable utilizing the information? Is he able to give us that teach back education? Because that's super important to assess him
Yeah.
because of his ADHD, his dyscalculia. Are we actually effectively working with him, or is what we're doing just as ineffective as it has been in the past?
Right. Like, are we just talking till we're blue in the face? Are we actually like getting through the message to him and like the important concepts? Like, you might not remember every single detail, but you remember like the most
No.
important things.
Yes. Uh,
And yeah, that goes back with the Davis Advantage textbook regarding ADHD and managing children with ADHD, making sure that we're actually properly working with him. So I'll throw in a citation for that. And folks, that is all.
That is it.